Okay, so now I'm going to focus on blocking out the skeleton. So I'm just going to do a new image, international paper, A4. Sounds good. Let's just make that an 8-bit. And I'm just going to sample one of these background colors just so I don't have a white sheet to look at. And yeah, using the sort of the method of using the cranial index and boxing that up, I'm going to use this to block out the skeleton. So the skeleton is going to be very simplified, and it's going to be based on the sort of drawings of Elliot Goldfinger from his book Human Anatomy for Artists. Let me just actually bring that up. He's just got some very simplified drawings in there that are great. So it's this book here, and it's the skeleton section. Of, you know, it just sort of deconstructs the skeleton, so you can kind of learn how to draw it pretty quickly. Because all we need to do is draw it so we can attach the muscles onto. So it gives us points of interest. So this is more complicated. You know, the earlier section is just very simplified shapes that I'm going to be using pretty much. So let's box this out. So I'm just going to go to we can draw a box ourselves. I'm just going to go here to the marquee tool and set that to fixed ratio. So when I draw a square, it's a square. And I'm also going to go window, arrange, and new window for untitled 1, which is just going to allow us to, when we draw anything on this, let's just say I stroke this in red or something, it's just going to mirror this over so we can see the whole image here, and just zoom in, etc. on this image. Okay, so I'm just going to undo that because that's a big box. And create a new layer. And again, you can draw out a square. I'm just gonna use this marquee tool just to block one out quickly. So maybe around here. Stroke that. That should be on a new layer, which it is. And now from this, I just duplicate this a number of times. So I've got the move tool active with the V key. I'm just going to hold Alt, left mouse button, drag. That's going to be the first two boxes. You can see this is extremely big here. I should scale this down. I'll do that in a second. I'm going to just create a midline as well, I think. So I'll just do a new layer. I've just got my brush tool I should have. Just create a line down the middle, maybe here. Okay, all the way through the image. Okay, that's fine. So yeah, I'm just going to carry on duplicating this box. So holding the Alt with the move tool active, I'm going to create two either side here, and I'll just take those two, Control E to flatten them, and then another two, and then another two. So this is going to be where the rib cage is going to go, where the cranium is going to go, and then the jaw, the mandible. This is where we meet the anterior superior iliac spines. So I'm going to create a half set now. So if I just duplicate this again, maybe around here, and then just erase the top. Just going to go back to normal now, so I can just erase that section. So this is the top portion of the character done. I think I will take all of this now and just scale it back, just so we can fit his legs in and everything else. Just maybe move him up. Okay, so now I want to do around 6 boxes going down. So let's just take this set. Again, this is going to be for 7.5. It's going to be a 7.5 figure man. 7.5 heads. So that's 3, 4, 5, 6. Okay, so he's in. That's our character in place. The arm considering putting it in now. I might just wait a second until we've kind of just roughed out these other shapes. So I think for now I will just flatten everything except for this one here, so I can use that measurement later on. So I've got all of this on one layer, I've got this center line on another. I'll just leave that as it is for now. So now very quickly, just going to create a new layer. I'm just going to start to rough this out. Okay, this very rough skeleton. So again, that's cranial mass here. It's going to be where his chin maybe goes. It's going to be the pit of the neck, fifth rib, bottom of the sternum, then the xiphoid process. So here, with the xiphoid process, going to be, on average, it's the widest part of the rib cage. 10th rib maybe somewhere around here. So if we were to just, the other thing I should put in is something like this. So this is where the seventh cervical vertebra is going to be on the back. So now we can just line these or match these sort of points together, and then maybe just take it straight up here. Okay, so that's going to be where our sternum is going to go. I'll just draw this like a tie for now. And then our clavicles, maybe here to here. Again, I'm just using very simplified points right now. This is where the anterior superior iliac spine's gonna hit, around here. If I just do another rough line here, that can be the highest point of the pelvis. I'll start to flesh in the sacrum around here. This can go down to the pubis. This will be with the posterior iliac spines, and then you can narrow this hip slightly, and just come in down and across, and then we can just pop these in. So again, I'm just doing this very rough for now. And then here I'm going to hit the the greater trochanter of the femur. So if we just pop this coming out, and then I'm going to take that down to around here, where it's going to meet the tibia. Oops, that's too short. So I said to around there. And again, if we just zoom out of this, we can see these proportions here. And then that's going to take us down to the ground with the tibia and the fibula. Okay, so just very crude line drawings at the minute, but we'll start to add a bit more sort of shape to them in a second. Okay, so with the humerus, that's going to be around two of these cranial indexes, so around here to here, and we can just pop that in there for now. Okay, so I'm going to go over these bones in a second, but it's just quickly roughing them out. And then let's go, if we take a fifth of this off, we said we can get the radius and the ulna section in, so maybe around here, just around here actually. and then we just put the hand in for now, just maybe there, I think. So yeah, I think around here will be fine. Gee, this feels a little too short here. Just erase that. It feels a bit better. Then maybe take the hand to around here. Again, I can refine this in a second. You know, I'm just doing very loose measurements at the minute. So what else do we need to stick in? Could pop the feet in, just very roughly for now. I think that's pretty much our rough skeleton. I'm going to go over this next, just to tidy this up slightly and add a bit more volume to the joints, so to the bones, I should say. But for now, you know, something like that should help you get up and running. Again, so we now got some points we can attach muscles onto. So if we're going to attach the pectoralis muscle, we know that we can do it a third down onto this humerus bone. The deltoid goes around halfway down, so we've got some points that we can attach to. But yeah, I want to add a bit more volume to this, so I'll do that in the next stage. Again, just very simplified shapes, but something just to add a bit of thickness to these bones, really. Okay, so I've just saved this scene file, and I'm just going to work on this a bit more to make this a tad bit more useful. So I'm going to start by taking this, and let's have a look. Just going to flatten some of this down so I don't have too many layers. Let's just flatten that for now. So I'm just going to wireframe. I'm just going to take the opacity down slightly so I can work on top of this, and same with this here. And create a new layer. And then I'm just going to just refine some of these bones a bit. Just take the opacity down, brush so I can be a bit more sketchy maybe. Okay, so yeah, so that's, let's go with that. So so maybe just work on the skull a bit more. And again, if we take that head and we pop in, just do this on this layer here, we pop in a center line. That's going to be where the eyes are going to go. Then back here we can, it's going to be the widest part of the cranium, and then just maybe it's going to come in, we can pop the eye sockets into here, the orbits of the eyes, that's going to be where the brow is. Just rough in this quickly, let's get his nose in, or not his nose. Then maybe his cheeks. Just starting to pop a skull in there. So that's his cranium. Got his cheekbones in there. His eye sockets. And let's just do his jaw as well. Give him some rough teeth for now. There we go. And let's work on his rib cage. So this is going to be where his clavicles meet his sternum. This section here, the manubrium. Let's block that in. Let's get the gladiolus in here. And then we've got the xiphoid process. Okay, so it kind of looks like a tie, and especially when you add the clavicles to this, it pretty much is just like a tie, I find anyway. I like to just think of it as school tie, business tie, very short. Well, it's more like a school tie because business tie would go down here. School tie, you're pretty unruly. Just going to be where the ribs are going to go. We can pop in the line where the kind of ribs turn to costal cartilage. So if we kind of just do a, oops, probably not that, something like this maybe. Same on the other side. Again, I've kind of not gone in, and well, you can if you want, just kind of adds a bit more shape to the rib cage if you wanted to. Again, it's not really necessary for this. But you can if you wanted to. I'll just pop that back in there for the 7th cervical vertebra. So that's kind of like our rib cage blocked out, and again this could be where the 5th rib meets the turns into costal cartilage and then meets the sternum. And let's go down. Let's maybe work on the ball and socket joint of the humerus. Let's crack that in here, and then pop down. Then here, I'm just going to pop in the medial epicondyle here, and then cut across for the lateral epicondyle. This is going to be where the radius and the ulna sit, the ulna and the radius on the outside. So just that simple shape will hopefully just give us a bony landmark here and here. And I'll highlight the bony landmarks in a sec. That should be very helpful. But for now, I'll just stick the ulna in, so it's thicker at the top than it is at the bottom, and just pop that in there for the styloid process of the ulna, another landmark that will be important. Then we've got the radius in here as well. Radius is the opposite, where it's thicker at the end than it is at the root of the bone. Going to pop this shape in there for the carpals, and then for the hand, let's just pop some kind of mitt in here for now. Just pop his thumb coming out here for now. Okay, we could start to, well, let's just, while we're here, let's just break this down a bit further for a maybe like that for now. That will do. We'll just leave that as it is. Then let's go on to the pelvis. So the pelvis I might make slightly higher actually. Feels a little low, but again we want that anterior superior iliac spine here. Just going to cut that across. And this is an important landmark here, the pubic symphysis, where they kind of meet here. Let me just come in, again pop that landmark in, and then cut across, and then maybe just cut across here. Okay, so next, let's get the femur into place. So this landmark here is important, so the greater trochanter, you should be able to feel that against your leg, or if you push against your leg there. Let's just cut back and drop in for the condyles of the femur, where it sits on the tibia. Obviously I'm not doing any of these sort of shapes with much care, I guess. This should be enough information to work with. So I'm going to pop the tibia in. Then tibia as it comes down here. We get the medial malleolus. Just cut that across. And then the lateral malleolus of the fibula should be slightly lower. And we should get the head of the fibula up here. And then for the foot, I think I'm just going to leave that very, very loose for now. 1, 2, 3, 4, 5. A bit too loose, but again, we can always come back to that later on. Okay, so that's, we can just pop this maybe. Again, it's up to you how much of this you want to add. Should be that necessary for now, I guess. Maybe make this thicker as it comes in here. And I think for the ribs I might just take this down a bit more. Okay, so I need to add the other arm and the leg, but I can do that off camera. And I think once you've done that, we've got a general skeleton that we can work with. I haven't popped in the scapula in here, which feel free to. I'll just quickly nail that in. But yeah, I guess when we do the back, we can pop that in there properly. For now, I'll just leave it like that, I think. I think if it needs anything else, again, some of this might need a bit of refining as we go. Maybe this is a bit thick here. I can cut that in a bit more. But hopefully, oh sorry, that's what I said I'd do. I said I'd kind of pop what these landmarks are. So we've got the pit of the neck. Ooh, I don't think red's a great colour right now. Got the pit of the neck here. Have the sternum and then the xiphoid process. And I'm going to leave out the skull for now. We're going to have the clavicle and the acromion process. Just mark the clavicle here. That's going to be a good landmark to hit. We've got the medial epicondyle of the humerus and the lateral epicondyle of the humerus. From the back, we'll also have the olecranon, the elbow. We want this styloid process, and sometimes, depending on the pose, you can also see the ridge of the ulna as well. And we want the greater trochanter. This one here, this anterior superior iliac spine. Anything else? Oh, medial lateral malleolus. So the medial, the inside, the lateral on the outside. The condyles of the femur, and also some of the tibia. We should also pop the patella in, I think. Why not? Let's just knock the patella in around here for now. So obviously that's a bit of a bony beast. And oh, we got the bottom of the 10th rib. Yeah, I think there. I haven't done the head really. I'm trying to think what else we should nail on the skeleton itself, mainly on the body. I think that's, yeah, that should be enough to get us started. There'll be other bits and bobs that will be important, but I think they should be good starting points. Okay, so I'm going to do the other arm, and then once we've done that, we'll maybe start to move over to the muscles for the torso, the trunk. Okay. Okay, so here you can see I've pretty much just copied this arm and this leg and flipped it over, and I've just tidied up the layers quickly by popping this as landmarks. This is a skeleton. This is the rough skeleton, so I'm just going to delete that. And I've got the cranial index grid still, which I'll keep alive for now. So I'm just going to, so it's quite useful. I'll just quickly go in and label some of these landmarks. Maybe that's useful. so you've got some wording here. So we've got the acromion process. Hopefully I'll get my labels correct for this, or my spelling. Here we've got the medial epicondyle. Let's just move this out of the way for now. We've got the lateral epicondyle, so lateral on the outside, medial closer to the center line, the medial line, lateral further away. So lateral epicondyle. Got the styloid process of the ulna. There's also a styloid process of the radius, depending on your, but you know, it depends on the individual how evident that is to the surface. Here we've got the acis, so the anterior, where is it, superior iliac spine, and there's a posterior to that as well. Back here there'll be, and then we've got the greatotrochanter. Trochanter. Down the medial and lateral condyles of the femur. Got the head of the fibula. And the medial and the lateral. Oops, put medial as well. Lateral malleoli. And we can stick in the patella there as well, the kneecap. What else have we got? Got the bottom of the 10th rib. We should probably pop in the manubrium in there as well, because that can be quite bony on some individuals. The xiphoid process, especially when you're taking a large breath in. If you pop your finger against your sternum, you can feel that there, evident there. Got the pit of the neck. And then the clavicles. So what else? I think that will do for now. We can pop in the carpus if we wanted to. They could be quite bony. Certain bones in there that are quite evident. But I think for now, oh, pubic symphysis, that's what I forgot. Pubic symphysis. Hopefully I'm getting these spellings correct. Knowing me, I'm sure there's something in there that's out of place. And again, this is for me mainly to learn and just have a document. So if there are anything that are glaringly obviously wrong, feel free to let me know, because that would be great, because I really want to improve my anatomy. Okay, that's the purpose of this. So having people with greater knowledge than me feeding back into this would be fantastic. Okay, I'd really appreciate that. So for that, I think we are done. Okay, that's all the landmarks that are important from the front, for me anyway, that I've researched and feel on myself as I'm doing this. I'm poking my own body and looking at this 3D total model to see if they're evident, if I can see them coming through. Okay, so next, muscles of the trunk. Okay, so mainly the chest and the abdomen region, and then some muscles going up to the neck. We'll leave out the head for now though, but we'll start laying them in. Okay,